Hi, welcome back to Pediatric Squad. So today we talk about one very common topic in pediatrics, and this is one of the topic that you must know and you must be very familiar with because it's very common. It's febrile seizure. So if a parent come with a baby with fever plus seizure, they must be very panicked. But as a medical staff, as a pediatrician, or as a medical student now, you shouldn't be panicked. Why? I will tell you in this presentation. Or if you're a parent who is seeing this video because your child is having one episode of febrile seizure, I want to reassure you that most of the time it's okay. Don't panic. So let me go through. So first of all, what is febrile seizure? As always, in medical term, we can always break down our terms, all right? Febrile basically means fever, okay? Seizure. The definition of seizure is uncontrolled abnormal electrical activity of the brain. So basically, your brain keeps having different kind of signal. It can present as different forms. For example, you will have loss of consciousness plus limbs twitching. It can be one-sided, it can be generalized limb twitching, or sometimes you can have eye deviation, or you can have the cyanosis of the lips. All right? So febrile seizure means the seizure during the fever. But interestingly, it is much more common in children. So in terms of the febrile seizure we're talking today, it's typically in children from 6 months to 5 years old. But provided that he did not have any other problems such as intracranial infection, CNS infection, metabolic disturbances like hypoglycemia, hypocalcemia, or he doesn't have febrile seizure. So that's the definition of febrile seizure. Basically, you have the seizure during the fever. So before I dig into the details, I would like to give you the most important message of this presentation. Fever plus seizure in children. Around 60 to 80% are simple febrile seizure. This is a very important term. You need to remember that. Simple febrile seizure. Why is it important? Because once you define it is a simple febrile seizure, it means that the condition is benign. It has good prognosis. And that's why in the beginning of the presentation, I told you not to be panicked. Because once it is a simple febrile seizure, you don't need to worry. Okay? However, those non-simple, we call it complex febrile seizure. So for those, we need to be very careful. We need to admit the baby. We need to do some investigation for the underlying cause. Later, I will talk about how do we differentiate between simple febrile seizure and complex febrile seizure. But before that, I would like to talk about why we have seizure during the fever for our kids. So first of all, it can be a genetic predisposition, which means it's due to the gene. Some babies, some children, it's easier to have the febrile seizure, some are not. During the fever, you will have the increase in body temperature, right? This kind of increase in body temperature can promote the firing of the neurons. So the neurons in our brain keep firing the abnormal signal, which can lead to seizure. All right? So also, during fever, you have many different inflammatory cytokines ongoing in your body. So this kind of inflammatory cytokine can actually disturb the blood-brain barrier, which basically a barrier protecting your brain from the blood so that the toxin, those sort of stuff won't go into the brain. This kind of inflammatory cytokine can disturb this barrier, and therefore it can increase the neuronal excitability and lead to seizure. So what are the common causes? Most of the time when your kids are having fever, most of the time they caught a virus, right? Common virus can lead to febrile seizure include influenza A, B, adenovirus, enterovirus when your child has the hand-foot-mouth disease, and HHV6. HHV6 can lead to roseola. So the classical case will be you have a 1-year-old child who has the fever without obvious cause, but somehow a few days later, the fever has come down, and then the rash comes up. Those are roseola. And during the roseola infection, they can have the febrile seizure. All right, so let's talk about the most important thing. How do we differentiate simple febrile seizure? I repeat, why this is important, because once you define that, it is benign and you don't need to worry. All right? So these are the characteristics for simple febrile seizure. First of all, it's usually within an age range from 6 months to 5 years old. Let's say if the child is 8 years old already with the febrile seizure, it is not a simple febrile seizure. You need to be careful. But then if within this age range, you can be much more comfortable. The duration of the seizure usually is less than 15 minutes. So be more careful if it is more than 15 minutes. And this is usually a generalized tonic-clonic seizure, which means both your upper limbs, both your lower limbs are having increase in tone and in twitching. And this is not a focal seizure. So let's say if you have a child with only one hand twitching, or one-sided left upper limb plus left lower limb seizure, those are not simple febrile seizure. The simple febrile seizure must be generalized, okay, 4 limbs. And it usually not recur within 24 hours. So if it recur a lot, be careful. But if not recur within 24 hours, it's more reassuring. And after every febrile seizure, even if it is simple, the children can have some drowsiness, or we call it post-ictal drowsiness. It's normal. They can be tired for some time. But then if it's prolonged, like prolonged drowsiness or confusion after the seizure, let's say 1 day, 2 days, then it's abnormal. Do be careful. But if it's not prolonged, then it can be a simple febrile seizure. And of course, the child needs to have no preceding neurological condition. Therefore, you actually need to ask in the history when you encounter cases of febrile seizure. You need to ask about the developmental history, whether the baby has previous significant developmental delay, and the past medical history, whether they have previous neurological condition. So if you can fulfill all of this, you can confidently say that, oh, this is a simple febrile seizure. I'm not that worried. Okay? So this is a typical example of simple febrile seizure. A 3-year-old girl, so within 6 months to 5 years old, with good past health, so no preceding neurological condition, normal development. So she developed fever, runny nose, and cough since yesterday, and then developed generalized tonic-clonic seizure for 5 minutes. So this is a GTC, and this is less than 15 minutes. And with around 30 minutes of post-ictal drowsiness, which is fine, and then become fully conscious, and then she is not ill, her consciousness is good, and it did not recur. So this is a typical case of a simple febrile seizure. When you encounter cases like this, it's quite reassuring, it is benign. So having said that, how do we treat the simple febrile seizure? Let's talk about the acute management. Let's say if you in the ward, you see a child having a seizure in front of your eyes, what can you do immediately? Of course, call for help. Put the child in recovery position, so lie lateral. And it's very common that some parents will try to put things into mouth. Don't do it. Put in recovery position. Basically, it helps the saliva to come out, reduce the risk of aspiration. If the seizure is less than 5 minutes, most of the time you don't need any treatment. But if it's more than 5 minutes let's say in the hospital or in your clinic, you can give the benzodiazepine to stop the seizure. For example, parenteral diazepam, intravenous lorazepam. So after the acute management, you need to take the history, right? You need to ensure it is simple febrile seizure. Like the criteria I have said, take a detailed history. And you don't need a prophylactic anti-seizure medication like carbamazepine. You don't need those anti-seizure medication because it's quite benign. And most of the studies suggest that you don't need routine tests like the blood test or the brain scan. You don't need that because it is a simple febrile seizure only. And parents may ask you, oh, should I give regular paracetamol or antipyretics to lower the chance of febrile seizure because it can lower the temperature, right? But then actually, regular antipyretics cannot lower the chance of febrile seizure, so you don't need to give it. But of course, if the baby is having fever, you can always give it as needed, but no need regular. and treat the underlying infection. So that's obvious. Let's say if you have influenza, you have a roseola, treat the underlying infection. But I would say most of the time it's due to virus, and then most of the time you just need supportive management. But of course, if it's due to bacteria, you need to give antibiotics. I've said that it's benign. So what is exactly the prognosis of simple febrile seizure? So actually it's good. But having said that, we need to counsel the parents. So actually around 1/3 of the children would have the recurrence of the febrile seizure before they turn 5 years old. Especially for those who had the febrile seizure at younger age, lower than 18 months, or those have the family history of the febrile seizure, or actually they have the first seizure at a lower temperature, so not very high temperature, they already can have the seizure. Those children can have higher risk of having another episode of febrile seizure. But then, although they have the seizure, it seldom causes brain damage. Okay. However, we still need to counsel the parents is that the family having the children with simple febrile seizure, actually they can have increased risk of epilepsy compared with general population. So what I mean is, if today you encounter a children with the epilepsy diagnosed, when you take the family history, sometimes you can actually find that, oh, maybe the children's elder brother has the history of febrile seizure. It can be simple febrile seizure. This illustrates that the simple febrile seizure patients can have increased risk of epilepsy in their family. All right, we have finished talking about the simple febrile seizure. So how about the complex febrile seizure? Actually, it's the other way around. So for those with a typical age, very young, lower than 6 months, or those a bit older, more than 5 years old, those long seizure, more than 15 minutes, those focal seizure, those non-GTC focal seizure, or if the seizure recur, all right? Prolonged drowsiness or confusion after the seizure, or those with preceding neurological condition. Or actually, the patient demonstrates some alarming signs suggestive of like CNS infection. For example, you have the neck stiffness, photophobia, petachy. And by the way, if you want me to talk about the CNS infection later, you can leave in the comment and I'll try to make a video later. Complex febrile seizure, why is it important? So if you have those alarming signs, just like I taught, actually this is very alarming. You need to admit the patient. You need to have investigation, including blood tests like the electrolyte, the complete blood count, like the glucose level, all right, to rule out other cause. Sometimes you may need the brain imaging, especially for those focal seizure, one-sided. You need to rule out any space-occupying lesion, any vascular event like stroke, any tumor inside the brain. And you will need a EEG, which basically just some stickers on your scalp, on your head, and then they try to see if there's any abnormal neuronal discharge from the brain. So what are the causes of complex febrile seizure? As I said, it can be epilepsy, it can be CNS infection, it can be space-occupying lesion, stroke, neurometabolic disease, etc. So what I mean is, it can be a serious thing. It can have some sequelae, it can have some complication. So we need to be very careful, all right? So management, treat the underlying cause. CNS infection, you need the antibiotics. Space-occupying lesions, you need to find out what it is. Epilepsy, you may need the anti-seizure medication. But anyway, you need to find the underlying cause for complex febrile seizure. Don't take it lightly. So conclusion. So most important thing is you need to know how to differentiate simple versus complex febrile seizure. For simple, you don't need routine tests, you don't need prophylactic anti-seizure medication, the prognosis is good. Complex one is alarming, you need to work out for underlying causes. Febrile seizure, do leave some comments to let me know what are your questions and what do you want to know more. And so if you like the video, I'm very thankful. Do give me a comment and also subscribe the channel. It will motivate me to make another video about the pediatrics. So we are Paediatric Squad. We'll see you next time.